Hello everyone, this is Dr. Ominde. In this series, we'll discuss the anatomy of the elbow joints. Okay, so just a brief osteology, the articulating surfaces, capsule, stability factors, movement, and applied anatomy. So you need to know that the elbow joint is formed by the union between, it's a complex joint. So you have the union between the humerus and radius. Okay. So the lateral condyle of the humerus with that's the capitulum and the head of the radius. Then you have humerus and the ulna. So those form the elbow joint. So you have the proximal part of the radius. You need to know there's a head, there's a tuberosity and a neck, and the distal portion of the radius has an ulnar notch to allow the head of the ulna and a radial styloid process. Then for the ulna, the proximal part is an olecranon. This is your olecranon process. There's an olecranon notch here, or trochlear notch and olecranon process. It has a coronoid process. This is the coronoid process of the ulna. Then we have a radial notch to allow the head of the radius, and an ulnar tuberosity. So you have your ulnar tuberosity here. And at the distal end, we have the styloid process. So remember, the radius is wider on the distal portion, while the ulna is bigger at the proximal portion. So we have a humero-ulnar joint, humero-radial joint, and a proximal radial-ulnar joint. So the elbow is a complex joint made up of three. The humero-ulnar joint is between the trochlea of the humerus and the trochlear notch of the ulna. Humeroradial is between capitulum of the humerus and the head of the radius. And proximal radial-ulnar joint is between radial head and the radial notch of the ulna. So if you're to classify it functionally, the elbow is a complex synovial joint of the hinge variety. That's functionally. So structurally is complex synovial, made up of humero-ulnar, humero-radial, and functionally is a hinge joint, and the proximal radial-ulnar joint is a pivot joint, synovial pivot. Remember, it's where supination pronation occurs. So this is just the extent of the capsule of the joint. You can see it covers the articulating surfaces up to the neck of the radius. So the annular ligament passes is extracapsular. So which ligaments support the elbow? You have the medial collateral ligament and lateral collateral ligament. So the medial or ulnar collateral has three parts. It has an anterior part, a posterior part, and oblique. So this is your medial aspect. So you have the posterior part, anterior part, and the oblique. So those are the parts of this is the anterior part, okay, of the ligaments. Then on the lateral aspect, you have the lateral collateral or the radial collateral ligament, as you can see in this image. So then we have an annular ligament that keeps the radial head in position. Remember, the radial head articulates at the radial notch of the ulna. So the annular ligament goes round. So this is the annular ligament. Then there's a quadrate ligament, as you can see it there. So those are the four ligaments: radial collateral, ulnar collateral that has three parts, oblique, anterior, and posterior, then the annular and the quadrate ligament. Then we have an interosseous membrane between radius and ulna, okay, and the humero forearm articulation. So between the humerus, radius, and ulna, you have flexion and extension movement. So that's the hinge joint. And the proximal radial-ulnar, the pivot synovial, allows supination and pronation. And remember, we said supination and pronation is when the radius moves in relation to ulna. So you have biceps brachii within the arm. Remember, we said short head is from the coracoid process, long head is from the supraglenoid tubercle. It goes to insert onto the radial tuberosity and the biceps aponeurosis. It's innervated by musculocutaneous and causes elbow flexion. So the flexors of the elbow in the anterior compartment of the arm, the extensors are in the posterior compartment. However, you need to remember that biceps brachii is the supinator major when the elbow is flexed. It causes supination, especially when the elbow is flexed. We have brachialis from the distal 2/3 of the humerus to the ulnar tuberosity and the coronoid process, also innervated by musculocutaneous. Muscles in the anterior compartment innervated by musculocutaneous, they are flexors of the elbow. In the posterior compartment innervated by radial nerve, the extensors of the elbow. So this one, brachialis, causes flexion at the elbow. Triceps brachii, it has three heads. The long head is from the infraglenoid tubercle. The lateral head is from the posterior surface of the proximal part of humerus. Okay, and that's the proximal half of humerus. And then the medial head is the distal 2/3 of the humerus, again below the radial groove. So medial head is below the radial groove, and the lateral head is proximal half of the body of humerus posteriorly. So it's inserts onto the olecranon process and is innervated by radial nerve and causes extension at the elbow. Okay, so the anconeus muscle, very short muscle from the lateral epicondyle of the humerus posteriorly and goes to the upper quarter of the posterior ulna and also the olecranon process. Also, it's innervated by radial nerve and assists in elbow extension. Brachioradialis from upper 2/3 of the lateral humerus supracondylar ridge usually goes to the lateral radius just proximal to the base of the styloid process here. It's innervated by radial nerve and it causes elbow flexion. It crosses the joint, so it will flex the elbow and may cause supination to mid position and pronation to mid position. Supinator, this is supinator muscle. It comes from the lateral humeral condyle and the lateral collateral ligament and the annular ligament. Then usually inserts onto the lateral upper 2/3 of the radius. It's also innervated by the radial nerve and causes supination of the forearm. Then we have extensor carpi radialis longus. So most of these extensors come from the lateral epicondyle, but this one is from the lower third of the lateral supracondylar ridge and inserts on the dorsal surface of the base of the second metacarpal here. The dorsal surface base of second metacarpal, innervated by radial nerve, causes elbow flexion, but also remember it causes wrist extension and radial deviation of the wrist. Extensor carpi radialis brevis, like other extensors, lateral epicondyle of humerus, other extensors, all extensors, most extensors of the wrist, lateral epicondyle of humerus to the base of the dorsum, third metacarpal, innervated by radial nerve, it will also cause elbow flexion. Extensor digitorum, lateral epicondyle, innervated by posterior interosseous of radial, but this one now causes an effect on the digits. Okay, all the other extensors, carpi ulnaris, will cause wrist extension and ulnar deviation, innervated by posterior interosseous of radial nerve, also originates from lateral humeral condyle. Pronator Teres causes elbow flexion and pronation of the forearm. It has two heads from medial humeral epicondyle and the coronoid process goes to insert at the lateral radius near its center. It's innervated by median nerve. Remember, the muscles in the flexor compartment come from medial epicondyle. They're innervated by median nerve and they cause flexion at the wrist and flexion at the elbow. Okay, so Palmaris longus from medial epicondyle to the palmar aponeurosis and flexor retinacula. It causes wrist flexion and elbow flexion. It's also innervated by median nerve. Flexor carpi ulnaris from medial epicondyle of humerus and also from olecranon and posterior border of the ulna. It inserts onto pisiform, hook of Hammett, and the fifth metacarpal you can see here. So it has three insertions and is innervated by ulnar nerve. It flexes the elbow but also causes flexion of the wrist and ulnar deviation at the wrist. Pronator Quadratus from the distal quarter of the ulna to distal quarter of the radius. Innervated by anterior interosseous, which is from median nerve, and pronator, it causes pronation. So what's the applied anatomy of the elbow? You can get radial dislocation from the annular ligament. This mainly in children. As the parents are picking children by lifting them from the hand, you can dislocate the radius from the annular ligament. Then, when you have repetitive use of the extensors of the wrist, you tend to get lateral epicondylitis, like in tennis elbow. And when you have repetitive use of your flexors, you get medial epicondylitis, like in golfer's elbow. So lateral epicondylitis extensors, like in tennis, medial epicondylitis in repetitive use of flexors in the forearm, like in golfer's elbow. So thank you so much.